right, welcome everybody. Welcome to the Maven School. We're very excited to have you here with us tonight. We're so glad you've joined us. And we're very excited to have Dr. Nakoshi Lamptey with us. Dr. Nakoshi Lamptey was one of the first students at the Maven School when it opened in the early 80s. And I guess that gives away your age, Nakoshi. Sorry about that. But anyways, we're so excited because she's a marvelous example of a change maker, and the Maven School is one of Canada's first Ashoka Changemaker schools. It's very fitting that she's here tonight talking with us. Dr. Lamptey is the Deputy Medical Officer of Health for the City of Toronto. She's been in that position since January of 2021. Before that, she was the public health and preventive, she was a public health and preventive medicine physician, she still is. And she's always been committed to improving population health and addressing health inequalities through clinical care, policy development, and system advocacy. Previously, she was the Regional Medical Officer of Health in New Brunswick, Program Director at Public Health and Preventive Medicine Residency Program at the Northern Ontario School of Medicine in Sudbury, Associate Medical Officer of Health in Sudbury and its district. She has a BA from Princeton University in Public and International Affairs and African Studies. She has a medical degree from the University of Toronto. She has a master's in public health from Yale University. And way before that, she started her educational career at the Maven School. And we're very proud that she's one of our alumni. The Maven School has always been really interested in the intersection of education and health and has taken a holistic approach to learning where the child is at the center and at the lead of the learning. And so we're interested to hear from Nakoshi tonight about the role of schools and schooling in public health promotion during COVID, but also generally. If the school is the heart of the community, what role can it play in raising healthy children? And how can schools partner with parents to create a system around the child that supports growth and development? Those are some of the questions we've asked Nakoshi to speak to tonight. I'm calling her Nakoshi because at the Maven School, everybody gets called by their first name. So I'm hoping that's all right. And with that, I'm going to hand it over to Nakoshi to speak. And there will be a chance, hopefully, to have some question and answer discussion after her address. So please feel free to add your questions to the question and answer tab at the bottom of your screen. Thank you, Nakoshi. Thanks for being with us.
Thanks so much for having me. I'm so delighted to be here. I hope we have great conversation and some fun meeting each other this evening. I come here with great humility in terms of being an expert as a person on this planet, in terms of the experience of going through the COVID pandemic. But really, I think the collective expertise on the topics we're talking about really lies among you. So I look forward to the discussion. So as Nancy said, I just arrived as the Deputy Medical Officer of Health. My first day of work was the day before the peak of cases in wave 2. So it has been a very busy time since I arrived. And now we have some opportunities for reflection on what that means and what that means for recovery of our families, our children, and our community. So if we can go to the next slide, please. What I hope we could talk a little bit about is what the pandemic has meant, and that's a very individual experience. We all bring different histories, settings, assets, and challenges to the experience that we've all been through collectively. But we do have some information about some particular impacts for children. And the positive aspect of that is that schools can actually play a really positive role in nurturing the kind of resilience we want to see in our children to grow up and be healthy, successful adults. And so we'll talk a little bit about that and illustrate how that has occurred through the pandemic. And very ironically, as a parent this morning, it was a tough day for me. And so I felt a little bit sheepish talking about some of the aspects of positive parenting, but I think that just illustrates that we all could use some help and assistance. And so I wanted to point us all to some resources that you can access. And I think it's perfectly okay to say when things are not going so okay. It's been a rough year. So if we go to the next slide, It just shows a pictogram of what I was saying, and that the pandemic has had many impacts. And some of them have been challenging. Some people have actually found that there's some aspects that have been positive. So for people who were essentially forced to slow down because some of the usual activities and venues where they would frequent were closed, they might have found opportunities to spend more time, meaningful time with their families. But not everyone comes to an experience with the same um, sets of strengths and assets. And so for many families, particularly those who live in low income or who have precarious work, the fear about potential loss of income was a huge source of stress. And if you think about who was more likely to be exposed to COVID, it was people who could not work from home, who we now call essential workers, who didn't just become essential in the pandemic. They've always been, but we just really shown a lot on the criticality of their work. Without a choice about staying home, their potential exposure to COVID was higher, and that, of course, induces stress. And then I think it's almost miraculous how within a year of a discovery of a brand new virus that just ripped through populations around the world, that we actually have vaccines which are a source of hope and protection. We go to the next slide, please. So Statistics Canada has actually done some searching of information about what has this pandemic meant for families and children. And this is a very busy slide, so they'll be shared afterwards and you can look at them more in depth at your leisure. But some of the things I wanted to point out is that there was some sense of loss. People were losing opportunities to be with who they care about, including friends and sometimes even extended family. If you were in different households at various points in the pandemic, we've asked people to stay within their household so-called bubble. And that can engender feelings of loneliness or isolation. And we're seeing that for some people that really did affect their mental health. And in particular for families, some of the stressors have been balancing caring for their child while sometimes having to work in the same space and contribute to their schooling experience, which for many periods of time in this province had to happen at a distance or remotely. And so as a parent, many of you probably experienced that trying to balance those three loads could also be stressful if your child's own stress was meaning that their behaviors were changing. And trying to manage that without losing your patience or raising your voice in itself can be a stressor. So those are some particular impacts on Canadian families and children. And if we go to the next slide, that's what parents overall were reporting, and in particular for very young school-age children, they were the most likely to express those challenges of balance. And you can imagine that's because, you know, younger children aren't yet necessarily developmentally independent. They are relying on you as a parent, even for some of the routine daily tasks of their schooling. They might need help to log on to their class, to find materials, and that can be difficult when you're at the same time trying to have a teleconference or video conference right next to them. I can speak to that from experience. And if we go to the next slide, please. If we then ask youth how they're reporting, how they're feeling, mental health really does come out as a concern for them. So parents are struggling with controlling emotions and guiding them through positive emotions, and young people are also reporting that that's challenging for them. And, you know, understandably genuine fears about getting sick or their family members getting sick. And you can imagine that for families living in multi-generational households, where you want to protect the older people who are more likely to get severely sick from COVID, but some family members have to leave the house for essential work or for other reasons, you can see that that would be a source of stress. And young people, we talk about this cliche about that they are our future, our collective future. They also think about their own future and worry about what it means to have the routine school year changed on so many occasions with long periods of distance away from their friends. And at certain stages of development, friends and peers are really their key touch points for how they grow and learn. And for older youth, some of them might already start to recognize about how the precariousness of work in the pandemic can affect them and their families. So if we go to the next slide. For me, I think the key here is, and look at this beautiful slide with that wonderful sign. Even with those challenges, we have a wonderful resource or sets of resources in every community, which is our children's schools. And to me, it's very impressive for me when I go for a walk with my children, how they are so proud to identify that the building that we walk by is their school. They really feel it belongs to them. Now, truly, that school belongs to the whole community, right? It's a public asset, but that sense of belonging and connection is not just a feeling, it's a resource to draw upon to build up various aspects of their development over time. And so we can really use that resource to help positively shape the intellectual and social development of children and their physical and mental health. The pandemic has impacted life overall, schools and schooling, but if we look at some of the examples of how we've used schools to build up children's, to protect children in the pandemic, we can use it as an illustration of the potential for the future to continue to use schools positively to promote health. So if you go to the next slide, please. If you almost think of the inverse of this, so this is again another Statistics Canada study or survey of the impact of school closures and the pandemic on children. And I won't go into all the details, it's a very busy slide. I think the overall point is that school closures have multiple impacts. So not just on academics, which might be the first thing that we think about, but for particular groups, it can have even more profound impacts because schools can actually be the place where they access things they may not be able to access in other settings. So this could have impact on their mental health in terms of connection, or even if you think about some of the screening interventions we do at schools to be able to pick up certain learning capacities. We know that if we can intervene early on those, and the children can have a sense of confidence that even with those challenges, they can overcome them and still contribute and fulfill their full potential. If they're not accessing those screening interventions or supports to help them fulfill their potential in the school, then that can affect their long-term mental health. Physical impacts. We know that in general, people's physical activity has really been constrained for a number of reasons during the pandemic. And we know that we have a goal of offering regular physical activity for children in schools. And if they're not in school, it can be harder for them to get that routine and regular physical activity, particularly when we're asking people to isolate and not interact. So those are just two examples, and there's probably going to be a lot of long-term follow-up on what this pandemic is going to mean for these measures for the group of children that have just experienced this once in several generation event. So if we can go to the next slide, please. So positively, if we talk about what makes a healthy school, you think about the capacity of schools to offer curriculum, teaching and learning, leadership and modeling in the classroom, engaging students in decision-making, providing healthy and social physical environments, and connecting the school with the broader community. When we in public health talk to schools about these concepts, the healthy school concept, there are correlations between strong, healthy aspects of all these dimensions and student resilience and student performance. And it worked best when it involves the whole school community. So parents teachers and staff, and the children themselves. So if we can go to the next slide. Very concretely during the pandemic, schools were implementing prevention measures and trying to promote mental health and well-being and resiliency. And even if it's not necessarily always explicit, when we have caring adults, we're showing students and children that they have allies, that there's someone who cares about them and their growth, development, and well-being. And allyship is important for children who need to find that within the home, but also without the home. Trusted people who are interested in their well-being. So if we go to the next slide, please. This is just showing that in the pandemic, for example, teaching children about hand hygiene and cough etiquette and those very basic measures to try and prevent disease spread is an example of using the curriculum in teaching and learning and even school and classroom leadership to teach healthy habits for life. If we think about the school as a hub for partnerships with the community, even in the pandemic, we recognize that schools were going to have certain people from outside the school, like certain visiting staff or visitors coming in, and we included them in the protocol, saying that they had to come in and wear a mask. If you think about the social and physical environments, we talked a lot about cohorting and physical distancing as environmental measures to help stop transmission. And there's a screening poster there. So those are all very concrete examples that are illustrations of how the Healthy Schools concept was actually being deployed throughout the pandemic. But we can build from that if we go to other subjects, if we go to the next slide. And I don't think all of these things are necessarily going to stop. If we think about what truly our youth are telling us is a challenge for them right now in terms of their mental health and well-being, because by the way, all those measures that we put in place actually did really help protect children in schools. Ontario probably had some of the best implementation of those principles in terms of keeping transmission in schools low. In the world, we were probably some of the best adherents of the cohorting and the distancing and so on. So if we can do it with COVID, which seems large and scary and complicated and ever changing, we can take that same success and do it for supporting our children's mental health and well-being. So when we involve students in whatever school activities are going on, their engagement actually helps promote their health because it promotes their agency, their sense of connection, their capacity to do things, and knowing how to work with others. If the school is part of the wider community and has some shared goals with the wider community, then that sense that I talked about my children feeling like that school belongs to them, that community will feel like that school belongs to them and help support the well-being of the children within it. Making schools feel welcoming, safe, and inclusive. So that's a safe social environment. And I think we'll talk about this a little bit later with some of the questions. Safety is not just about physical health. People need to feel like no matter who they are, that they are loved and valued. And if they don't, that can have lifelong consequences for their health. So if we go to the next slide. So what does that all build towards? Well, if you ask most parents what they want for their children, they want their child to be happy, to fulfill their potential, to feel like they know their place in the world. And one of the things that really helps children feel that way is the sense of resilience, which you can think about is the flexibility or elasticity to bounce back from life experiences that can be challenging, like the pandemic, or it could be a move, which my family has just had to experience, or the loss of a loved one. And so the ability to cope with those things has to do with, as I just talked about, a sense of belonging, having a positive and hopeful attitude, feeling like you can solve problems as they come to you, being able to deal with your emotions. Every human has them, but being able to deal with them in a healthy way, and knowing that you can rely on others when you need help, and that those interactions are going to be positive. So if we go to the next slide, resilient children are more likely to be happy and successful adults, and we can help build that with recognizing that that is involved in relationships, sense of gratitude and self-compassion and self-care. If we go to the next slide, the things that children can have that help build resilience are what I've been saying for the last little while in terms of feeling safe, feeling supported, feeling like there's people around them who care about them, the hopeful and positive attitude, and actually a sense of enjoying helping others is a component of resilience. I think that just goes to show you that human beings really, we're designed to be social creatures. Self-esteem and feeling connected to the school and community. If you go to the next slide, please. So interestingly enough, children are really wise. If you ask them what is helping them, they're going to actually talk about many of the things that would help build those that positive elasticity. So we're not only social creatures, we are part of the natural environment, and getting out into nature does help mental health and well-being. Those routines that we're very keen to reinforce with our children about eating a healthy, balanced diet and getting enough sleep, those are also important for positive mental health. Connection with pets can be a great source of strength for people, as well as connecting with friends and family. So this is all building to the notion that there are things that can build resilience. Children can be given experiences that will build those assets that will build their resilience. And if you ask children, they'll actually tell you what those things are. So if we go to the next slide, here's just some tips. So as of tomorrow, we're going to be opening or entering a new phase of provincial reopening. And so there will be more things to do outside. But in the time that you're at home, there's many things that you could do to have positive connections with your children. And just the act of engaging with them is actually helping building their resilience. So if we go to the next slide, please. I think this is where the notion of what schools can do gets reinforced. So if we talk about the school community being a place where children are, where they're the people who teach them and they learn with are, and other wider members of the community that are invested in their health. All the adults who are in that circle can be potential allies to let them know that they're there to listen, and so that the exchange of information is not just one way, that children actually feel they're being heard and they're contributing to meaningful conversation, that they aren't being judged when they share their feelings. And if you as an adult actually have some ability to find more about what mental health literacy is, that'll actually help support the mental health of children. If we go to the next slide, please. So families make a difference. I'll maybe go through this a little bit quickly. So having a loving relationship with your child, living it by showing or modeling how we want to see them live in a positive way. And loving means understanding and having empathy, but also knowing we need to set limits so they understand that they're in a world with other people. And part of interacting with other people is having limits sometimes of what you can do to respect the lives of others. So we go to the next slide. That strong relationship of unconditional love. Unconditional love means that that child knows that you are there for them no matter what. and that even if something goes wrong, you have empathy for their experience and you help them learn and work through it. Knowing that they're connected to you and that there is special time for just you and them, so that they know that that love that you have is focused on them and a special moment, really is important for children's resilience. If we go to the next slide, please. And many of you are probably naturally already doing this, but sometimes in the pandemic, it gets hard to remember about the importance of special time because time seems so disorienting when you're not sure, is it Wednesday today, is it Monday? When that sense of almost Groundhog Day occurs. When we communicate with children, they really do want to be heard, they want their feelings and opinions respected, and they want to be caught doing something right. So this is the corollary of the unconditional love and setting limits. Is we also have to notice when they're respecting those and help to reinforce that they're doing those things well, including praise. Next slide, please. So setting limits with expectations, allowing constrained choices, so not endless choices and ongoing negotiations, but knowing that they can have an action and a consequence, helps set them up for all the choices and limits we face in our lives. Next slide, please. So this one can be challenging, right? Because we all have temperaments, and some of us are more naturally optimistic than others, but we can actually train ourselves and our children to be able to recognize when they're falling into traps of thinking negatively. And this means that if there's a negative statement about themselves that might be affecting their self-esteem, training them or pointing out to them that there's another way to look at it, and talking about the evidence of that not being the case. And so training them to see those patterns and to be able to adjust them can actually help people become more optimistic, even if they're not temperamentally. So we can go to the next slide, please. So stress is something that's a part of life, and the resilience is about the ability to cope with it in a healthy way. And so having them learn how to not only identify their feelings, but to name them and to then have solutions around those feelings is a lifelong skill they're going to practice if they can start to learn it early. Next slide, please. So schools, we've mentioned as like a physical and emotional locus of connection. And that can be reinforced when that sense is brought to the home in the sense of caregivers supporting what the school is trying to accomplish, so that it's a team approach. Everyone is invested in what the child is doing. So sometimes that means assisting with homework, but also pointing out when they need to be able to do it on their own and setting up the environment that's going to help them successfully complete their homework if they have it. I can recall as a child how excited I was when my parents came to any school event. And I think it was that same feeling of, this is my school, this is my family, and the two of them are coming together. And I'm so proud. And I remember feeling, I'm so proud that as a child, both are coming together visibly. My parent is in the school, I'm in the school, we're all together in the school, we're all one. And being an advocate for your child's growth and development with the school staff. Next slide, please. So I just wanted to show you this little video if we can play it, because like I said, if we listen to children, they'll tell us what works for them. So we'll just take a couple minutes to see this.
Notice me and smile. Ask me about myself. Be honest with me. Empower me. Ask me to help. Make time for me. Surprise me. Surprise me. Believe in me. Show up at my games. Listen to me. Respect my choices. Help me make decisions. Listen to my stories. Read to me. Read to me. Read to me. Catch me doing something right. Let me act my age. Be silly with me. Tell me a joke. Play with me. Help me be my best. Share a meal with me. Build something with me. Be happy. Ask for my opinion. Visit my school. Trust me. Expect the best.
So I think that kindergarten class said it better than I could. So I encourage you to look at that video again. There's some great messages there. So we go to the next slide, please. So just wanted to say with deep empathy, as I said, it's been a challenging year and you don't have to feel alone. I think the whole notion I'm trying to convey is that the school really is about a group of people caring for each other. And so school staff can be a source of support as well as professionals in the community. And if we go to the next slide, here are some examples of resources for parents and caregivers. These are some visuals, but they're also listed in some references at the end. If we go to the next slide. And, you know, parenting is a lifelong journey. I think you're a parent until you leave this world. So I know I've certainly as a parent looked at resources at different times and found it really helpful. It's part of the lifelong journey of learning. If we go to the next slide, please. Also wanting to make sure that you're aware that there are professional resources that are available 24/7 for people who are truly in distress. And I think this is, we know that call volumes for mental health support have been increasing to a great degree because of the pandemic across all age groups. And I don't think that's necessarily going to subside with case counts. It's going to take all of us time to heal from what's been a challenging year. So if we go to the next slide, just the references. So I'm happy to stop here if people wanted to have any questions and answers, or some additional slides if there are questions about youth vaccine, but I'd love to hear if there are any questions from the participants.
Thank you so much, Nakoshi. So I'm going to ask some questions that people sent in ahead of time.
Sure.
But as I'm doing that, if people would like to put questions in the Q&A, we will monitor the Q&A and we can continue to ask those questions as well. I'm just reminded as you're talking, what a great resource we have in Toronto Public Health and how many helpful resources there are on the website and with our school liaison nurses and all of that. So thank you so much for bringing those resources to us. I'm going to start with just some really concrete COVID questions, and then we'll get a little bit more philosophical. So one of the questions people wanted to know, a couple of people asked about masks. Do you think in September we're going to need to be wearing masks in schools? Do you think the smallest children will need to be wearing masks? Is there a time when we won't need to be wearing masks anymore? What are your thoughts about masks?
So like a true scholar, I'll say it depends. So some of the factors that will contribute to that, I think, is whether we're able to immunize the school age population to a sufficient degree before the school year starts. Recognizing that right now, there's one mRNA vaccine that's licensed for use in children aged 12 to 17. So that means the younger school age population still doesn't have the ability to benefit from immunization. And in terms of when those products will be licensed for the younger school age population, we don't know. The clinical trials are ongoing. I think the results are looking promising, but it does take time to go through the regulatory process. So if those products were licensed in the summer and we had enough time to immunize sufficient numbers of school children, then potentially there might be less mask wearing. I'm not totally convinced that we will completely lose the use of all masks in all settings, because immunization is one tool of defense against this virus, but it's not the only tool, right? It's an assembly of things that work together to form that protective web. So one, you need high rates of immunization. And if that's not available, then we're going to continue to have to use all the other prevention measures as well. And in certain settings, it's probably going to be indicated for a while. So that's a long answer to say it depends.
And do you have a prediction of what it's going to look like in September for schools with various COVID protocols? And do you have a theory? I know we don't know, but do you have a theory about what schools might look like in September?
Well, I think some things we're going to continue to emphasize because they make good sense all the time. It's just that COVID really highlighted them. So I think the notion of making sure your child is well before they go to school is probably going to remain. We shouldn't be sending sick children to school, not just because of COVID, but because there's many infections that can be transmitted in close quarters. And for example, influenza. And we had almost no influenza activity this past year. It was remarkable. And it was probably because we were benefiting from all the hygiene measures we were using, like hand washing and distancing and staying home when you're ill. So I think that will remain. I think there will probably be some component of mask wearing in some settings, maybe in some aspects of schools, we'll see. And I am hoping, I don't know, but I'm hoping that there's going to be systemic discussion about how we support students to start the new year, given disruptions in the past year. I don't know that we'll be serving children that well if we kind of just don't address what has been going on for the past year. So I think this is where we can be creative. What does it mean to support students to transition back to school when they've been away from school and have had different modes of learning for an extended period of time? It might take some reorientation. It might also take some directed looks at how do we identify the children who really struggled more than others so that we can support them. I think one of the things that the pandemic has highlighted is the interest in, as I said, the role of being outdoors in health and well-being. So we can probably get creative about how, am I still there?
You're back.
I'm back, okay. Sorry about that. I think that was just an internet connection issue. And some schools have really, built their entire philosophy around that. And we can bring that, I think, into more and more aspects of teaching and learning. We know it's good for physical health. We know it's good for mental health. And then even from an infection prevention and control, there's great ventilation outside.
That brings me to another question that people have asked, and I have strong opinions about this, but I'm wondering about your opinions. Should virtual learning always be an option for students? What are your thoughts on remote learning?
Oh, there we go. I heard
You're
should.
back.
Yeah, I heard should, and then I lost you. Sorry about
Oh, that's okay. That's okay. So my question is, what are your thoughts about remote learning? Should it be a permanent fixture in education, or is it something that should be reserved for emergencies only?
Are you asking for a professional opinion or a personal opinion?
You could do both. You could say as
Yeah.
as a doctor and as a mother.
I think professionally there's signals that remote learning really did challenge the sense of connection that children need for their growth and development, and it probably can exacerbate inequities in that not every child has access not only to devices but to stable internet, but even to a caregiver who can sit next and support that remote learning, because some parents and caregivers have to work multiple shifts and multiple jobs. And just can't provide that support. And so I think there's a challenge about exacerbating inequities if that is the only option available. On the other hand, there are some children who preferred it and may have thrived with that. So if we're truly going to be child-centered, I don't think it's about having blanket approaches, but really making sure that the decision is most appropriate for that child, and that the system is able to accommodate, the diverse needs of children. They are unique, powerful, even though they're little people, and we have to have the systems that recognize and respect that. I mean, so much I think of, unfortunately, the discussion around schooling was premised on schools as basically childcare to allow parents to work. But schools have a different purpose, right? It's the essential work of children to be at school, to learn and grow. And if we look at it that way, then I think you have different discussions and probably make different decisions.
That's a great segue into my next question. You've mentioned in your talk that COVID-19 has made income disparity and the consequent health issues more visible than ever. And in Toronto, people in high poverty neighborhoods have been more at risk in contracting COVID-19 than people in higher socioeconomic conditions. So what role do you see schools having to play in rectifying these inequalities? So I'm talking a little bit beyond COVID-19 now and the role of schools in general.
Well, part of the reason I focused on resilience so much is that there's very good evidence that early childhood education, which schools play a role in, is actually a huge contributor to reducing health disparities. So when people talk about the social determinants of health, like income and housing and stability of employment, for most health outcomes, we see a gradient where people who have poor in terms of less quality housing, lower incomes, lower education, have poorer health overall across a range of conditions. And those differences start to accrue early and then accumulate over their lifetime, such that you actually see lower life expectancy for people living in low income neighborhoods. So if we talk about the medicine to treat that, early childhood education actually is one of those medicines that has been shown to work. When children have access to high quality education early on in their life, it actually levels and starts to diminish or erase some of those differences in health that start to get observed, at school entry or before, and then last for their lifetime. So the interesting thing is that it doesn't just affect their mental health and their academic performance. Their probability for chronic disease like diabetes, heart disease, are actually affected by the quality of that childhood education and learning environment very early on. So schools can be that medicine, right? Good quality schooling early on is that equalizer for health. So we need to make sure that all children have access to that, and that good quality education is not just for people living in high income neighborhoods or for people who have lots of already assets and resilience, that it's universally available. And we have that spirit in Canada. If you think about, we're very proud of our universal healthcare system. We don't think that you should have to not be able to get a life-saving treatment just because of how much money you make or where you live. So it's not really out of keeping for us to want the same thing for our children's education, that no matter where a child is living, that school can be a safe, nurturing place for learning that allows them to fulfill their potential for the rest of their life.
It's so funny. I used to work at the Ministry of Education, and I would often speak to the teachers I was working with, the principals I was working with, about what a fine public education system we have. I know that's a funny thing for an independent school principal to say, but it's true. We have a wealth of good schools in Toronto, and oftentimes teachers don't even know that we're one of the top performing education systems in the world, and unusual in that we have preschool, JK, as a full day program, a universal program, at least in Ontario. So it's interesting that sometimes people don't realize that the investment in those early years is so vital for the economy, for the health of the society, for the health of individuals later on.
Yes, and I think, you know, the content of what I was saying in terms of a healthy school community being one that engages with children and makes them feel valued and loved and cared about. Unfortunately, not every child necessarily gets that at home, right? And so the school can actually be the place where the resilience is built, not just reinforced, but, you know, built sort of piece by piece.
When I was a public school principal, I was at a model school for inner cities, and we did some research on resilience. We did resilience surveys with Toronto Public Health in grades 4 and above, and found that when there were strong programs in the school, strong curriculum, strong relationships with families, that resilience was increased. Has there been any talk at the city level or the provincial level about measuring resilience so that we can identify, you know, which students are more at need as we return to school?
That is a good question. I don't know the answer to it. And this is probably reflecting my newness to the city and not having come at a time when a lot of the routine programming would have, you know, been occurring. So the school liaison team was heavily focused on supporting schools to be able to implement COVID prevention measures and learning about COVID and supporting testing and outbreak management. I think their normal role on supporting resiliency building was sort of overtaken by the pandemic. So I don't know. I would imagine that there is some work on that, but I don't know for sure. I do know we're starting to think about what does recovery mean. And like I said, I'm hoping that we can start to think meaningfully about how to identify who needs more help as we reorient to school in the fall. But how that's going to be done, I don't think anything's concrete as yet. Has not been determined.
Can I ask you, Nakoshi, I know from your own experience as a student, you have some ideas about the kind of learning that should be happening in schools. We've had a number of shocking, if not surprising, events over the last 10 days. We've had the 215 children whose remains were found at the residential school in Kamloops. We've had the attack on the family in London, Ontario on Sunday night. We know that our school system has historically played a role in negating culture, negating self-esteem at times. And I'm just wondering, you know, I think that there's much more exposure of some of these injustices right now, and this disruption could be a very positive thing for schools and schooling moving forward. I wonder what your thoughts are about the most important skills or ideas that schools should be teaching and how they should be teaching them in this moment of disruption.
I think the word empathy is really key. And if you think about very, very small children, if they see another person crying, will often start crying themselves. So I feel like that is a very early instinct and powerful ability we have. And we need to continue to nurture children to rely on that. And it's a component of emotional intelligence that is not only important, I think, for social cohesion, but also for their individual success as they grow older. So if we just think about the basic notion of empathy, if we see the next person next to us as a person, regardless of who they are, where they came from, what they look like, what language they speak, what food they eat, if we recognize our fundamental common humanity in each other, and therefore care to treat each other with respect, and can understand their position. It's just a pediatric intrusion. I think asking about bedtime. So if we can build that empathy muscle, then I think it's less likely that our children will grow up to contribute to systems that erase, ignore, discriminate, oppress others. And the Truth and Reconciliation report from 2015 has a section about what we need to do in education as part of reconciliation. And it comes right after the section on youth and residential schools. And so in that report, you can see that those themes were so related to each other. And they talk about the importance of schools having curricula and teachers who can not only teach about the experience of Indigenous peoples, but build values of empathy, respect, and understanding of the culture of Indigenous peoples. And so even I think in the generation between when I went to school and now what my children are learning, even my toddler knows about Orange Shirt Day and knows about the residential schools. And asked me when we bought our house if we paid the Indigenous people for the use of their land. And that was a very, thought-provoking question, but she was recognizing that at her young age that there's a history that we have to understand. And every time we do something, think about, are we acting in a manner of reconciliation?
That reminds me, I started reading report cards today. It's that time of year where you start reading report cards. And on our report cards, there's a section where it starts with a student reflection, because our students do a lot of reflecting and goal setting. And so I was reading the junior kindergarten report cards this afternoon, and the reflection was, the little boy said, "I want to be everything the world needs." And he's 4. It was pretty awesome. I want to be everything the world needs. So I guess it all does come back to empathy. And that kind of brings us back to where we started. As an Ashoka Changemaker School, we believe that empathy in action is kind of the key to the future, and that everybody can be a change maker. So I want to thank you. I want to thank you, Nakoshi, for being such a model of change making and empathy. This has been fascinating. It's been really helpful. It's been really grounding. And it's nice to talk about important things in a moment where the world seems a little bit absurd. So thank you so much for your time tonight. Thank you to everybody who came and joined us. We're going to share this video with the people who weren't able to come, with your permission. And I hope you'll come back again soon to the Maven School.
Of course, it's my pleasure. Thank you so much for having me.